Hi there! Welcome to this video on the breastfeeding journey. We will learn more about the following: the importance of early skin-to-skin contact for the mother and newborn, effective latch using calm approach, expressing breast milk using Massey method, and how to manage common problems during breastfeeding. One of the important steps to start the breastfeeding journey is to arrange for the baby to have skin-to-skin contact with the mother immediately after birth. The newborn is placed directly on his mother's skin after birth and within an hour has his first breastfeed. Skin-to-skin contact for mother and newborn is important and beneficial for both mother and child. For the newborn, it helps to maintain his or her temperature and blood sugar levels, stabilize baby's heart rate and breathing, reduce crying and stress in baby, and most importantly, the skin-to-skin contact allows baby to start breastfeeding early and receive his mother's colostrum. The newborn baby is also colonized with mother's skin organisms, which is beneficial for baby's gut microbiome. For the mother, skin-to-skin contact reduces her stress and pain levels, releases oxytocin, which increases bonding and reduces postpartum bleeding. Studies have shown that early suckling helps with womb contraction and reduces blood loss after childbirth. Facilitating immediate and uninterrupted skin-to-skin contact directly after birth also supports mothers' initiation to breastfeeding by increasing breastfeeding rate and duration. A good practice is to ensure that immediately after delivery, with a well baby and mother pair, we can proceed to provide baby with skin-to-skin contact with mother. This is especially important for the first hour after delivery, sacred hour. Unless medically indicated, allow the baby and mother to be alone during this sacred hour. During skin-to-skin contact, the newborn displays an impressive and purposeful motor activity, which brings the baby to the breast to start breastfeeding. 9 instinctive stages have been seen in a healthy, alert newborn. This process typically occurs over 45 to 60 minutes. Do not rush to place the baby to the breast or force the breast into baby's mouth. If possible, allow baby and mother to have uninterrupted skin-to-skin contact and their first breastfeed. Routine procedures for the newborn baby can be performed without interrupting this first hour. Some situations may pose challenges to successful early skin-to-skin contact. These include unwell mother and/or newborn. Interruption by routine tasks can be performed after this first hour. Unfamiliarity of expectant parents on skin-to-skin process. If the mother has a cesarean section, she can also experience skin-to-skin contact with her newborn. 24 hours rooming in is encouraged with support from family or hospital staff. Here are some breastfeeding positions for new mothers to try, including side lying, cradle, cross cradle, and football. Mothers can use any position comfortable for them to help the baby get and maintain good latching during breastfeeding. It is important to ensure that mothers are close to their baby at all times, rooming in with no separation so that they get plenty of opportunities to practice positioning and latching. Here are some key pointers for each of the 4 positions. The cradle position is perhaps the more familiar position that allows mother and baby to coordinate and latch well. The cross-cradle position is suitable for smaller newborns or premature babies, and it involves supporting the back of baby's head and shoulders with the mother's palm and holding up the baby's body and buttocks with forearm. The football position may be used for mothers who have undergone cesarean section. Similar to the cross-cradle, the mother should support the back of baby's head and shoulders with palm and tuck baby under her arm. The baby's legs will be behind the mother with his head at mother's breast. Finally, the lying down position is good for mothers recovering from post-cesarean section or forceps use during delivery or at night feeding. The mother lies on her side with a pillow under her head and back, and the baby is held facing the mother. When it's time for baby to feed, the mother should hold her baby close to her breast in any of the breastfeeding positions comfortable for her. Some tips to ensure the mother's comfort include ensuring the back is straight and supported. If sitting up, the mother's lap and feet should be supported. Pillows or cushion can be used to support her back and/or arm. Baby should be held close and facing the mother's breast with his head, shoulder and body in a straight line. Bring the baby to the breast instead of moving the breast towards the baby. Aim the nipple towards the baby's nose or top lip. Baby should be able to reach breast easily without having to stretch or twist. The mother can then guide baby to latch onto her breast by bringing the baby's mouth over and above the breast. Once baby has latched well, the mother should ensure she is comfortable too, to avoid backache and tired arms. A good latch-on ensures comfort for both mother and baby, an effective milk transfer to baby. With a shallow latch, the mother's nipple lands near the front of his mouth and presses against the hard palate. Over time, the friction and pressure can cause nipple pain and soreness. With a shallow latch, baby is unable to effectively remove milk from mother's breast. When the baby takes the mother's breast deeply into his mouth and latches on so that the nipple lands in the comfort zone between the hard and soft palate, there is no undue friction or pressure. This is a deep latch and makes breastfeeding a comfortable bonding experience for both mother and child. The calm approach can be used to check if the baby is latching well. Check that the baby's chin and cheek are close to the mother's breast. Her areola should be covered as much as possible, with the baby's upper and lower lips flanged out and mouth wide open. As some babies may have receding chins, tilt the baby's head backwards to help to get his tongue and jaw under the breast. When the baby has latched well, the initial sucks are rapid and shallow, which help to bring on letdown. The sucks and swallows soon become slower and rhythmic with deep swallowing, without clicking or smacking sounds. Pauses in sucking while breastfeeding are normal and will get longer as sucks and swallows get shorter towards the end of the feed. Mothers can also use the acronym PASS and 2Cs method to assess if breastfeeding is going well. PASS stands for position, attach, suck, swallow, and the 2Cs stand for comfort of baby and mother and confidence of mother. Understanding the key points about PASS and 2Cs help mothers along in their breastfeeding journey. While breast pumps are widely available now, it is still important for mothers to learn how to do hand expressing of breast milk for the following reasons. Knowing the masse technique for hand expression helps them check that their breasts are softened enough, prevent painful lumps from building up, and express milk for collection. Mothers may need to perform hand expression as it can be difficult for babies to attach to a full breast, and full breasts also cause discomfort for mothers. The massage technique consists of the following points. The first part, MA, refers to massage. As we massage the breast in a circular motion or with 2 palms, we feel for any dense areas that may need to be worked at. S refers to stroke gently from the corners of the breast to the center. And the second S refers to shaking the breast gently. The second part of the technique is to hand express by placing the thumb and index fingers around the areola. Push inwards towards the chest wall and start to express milk by squeezing the breast with our thumb and finger. New mothers may face challenges at the start of their breastfeeding journey. Here are some common problems and solutions. Pain or discomfort when baby first latches during breastfeeding is normal, but the pain should go away. If pain during breastfeeding persists, the baby may not be latching well. The solution is to gently detach the baby and reattach. Having sensitive nipples in first week of breastfeeding is another problem some mothers face as well, as the body gets used to it. Sore or cracked nipples is another common issue that can be due to improper positioning or latching during breastfeeding. Possible solutions include reattaching and repositioning the baby, reduce duration but increase frequency of feeds, breastfeed on unaffected breast, and express some breast milk to soothe nipples. Breast engorgement after birth can be due to missed feeds and cause discomfort to the mothers. To reduce the problem, mothers can express breast milk if baby has trouble latching, massage breasts gently during feed, express after feed if breasts are still engorged, or apply cold packs in between feeds or expressions to relieve any discomfort. Finally, blocked ducts can also cause pain and discomfort. To alleviate, mothers should initiate breastfeeding from unaffected breast, nurse often to keep breast empty, apply warm compress over lump towards direction of nipple, change position to help empty breast during feed, and hand express breast milk if necessary. If symptoms persist, seek professional help early to prevent infection. Thank you for watching this video. We hope this has helped you understand more about breastfeeding and the importance of skin-to-skin contact for mothers and newborn babies. This video is presented by Yong Lu Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.